everyone, and welcome back to our final session of day one of MPHA's annual conference. I'm excited to learn about Rotaries, breweries, and food trucks' creative recruiting for successful large-scale vaccination efforts. And I'm joined by Melissa Focasato, who's the Director of Community Health Improvement, and Jesse Chalmers, who's a prevention specialist, both with Midcoast Hospital, to tell us more. So thank you, and I will turn it over to you for your presentation.
Thanks, Heather. Hi, everyone. I'm Melissa. As Heather mentioned, I'm the Director of Community Health Improvement for Midcoast Hospital. In the past, that's meant overseeing our tobacco grants and our physical activity work, our Let's Go work. But starting in 2020, that also became looking over our vaccination efforts. Jessie is here as well. She's really the woman in charge of all the logistics at this point and started really early with us. She was our Let's Go coordinator and jumped over early to help with the vaccination clinic. We have nothing to disclose. So we really took a public health approach to this. Jesse and I are both public health people. When we were tasked with this big endeavor, we took it from the community organizing perspective. And I think that was an advantage in our community. We really could think creatively about the non-clinical work, and that really helped us really stand this up really quickly at a time where our clinical partners and colleagues were really busy treating COVID in the emergency department and on our units. So a brief timeline in case anyone's forgotten, that in March of 2020 was when COVID-19 was declared a global pandemic. In November, the local hospital systems in Maine were tasked with vaccinating their staff. At that point, that's what we thought was our role. And that's when I became involved with a small paid staff and redeployed staff. But we quickly realized with the Maine CDC and the state that to really undertake vaccination efforts that we would really need the hospital's partnership. So the EUA, the emergency authorization, happened December 11th and 18th, and staff began vaccination December 16th. But somewhere in there, I don't even remember the date, we also received permission and had the request to vaccinate the community. So while we were vaccinating the frontline staff, we had to start planning this mass vaccination clinic or large scale vaccination clinic. We decided that we had to have a bigger space. We were in a decent size location at the Midcoast Hospital, but we needed to think big. So we looked at our Brunswick Parks and Rec building, which had a really larger capacity. We knew we'd have to do at least 800 vaccinations a day and about 4,800 a week. So we looked to our partners, and that's where we went from end of January to June 1st. May 4th was when the eligibility dropped to 12 plus. That was also, if you remember, there's 2 Pfizer shots. So that was about 3 weeks later, we had to get dose 2s in, which was about, of course, about when school was ending. So we decided to also add some school clinics to our outreach to make sure we were reaching all those kids before they went away for the summer. And then June 1st, we moved to our permanent space, which is our capacity is 36 an hour. However, in November, the eligibility dropped again for 5 to 11-year-olds. So we had to reactivate our clinic, and we took it to a local elementary school. So what we're going to talk about today is a model that is really flexible and really served us. So we really are, I call us the strike team, where when there's an eligibility change, when there's a demand, we reopen the doors, and then once the demand is manageable, then it goes back to our practices. So the community need at the time was we needed to staff 2 5-hour shifts 6 days a week. That's about 1,000 doses a day. And that took about, what we found was 16 clinical and 25 non-clinical staff per shift. So what needs to be done? What did we need help with? First was the logistics. We needed to get people there. Our clinic was at the rec department, but the rec department was on a former Naval Air Base, which was, some people know how to get there, but it's a little bit of a maze. So they really took care of doing the wayfinding and the signage. And the police departments were there to help with traffic control. And the town took care of the non-clinical. There were a few things that the hospital did, but really the town took care of making sure to clean up that area. And those signs, although that sign in the corner there, we got well trained on how to turn on those signs. Those were others' duties as assigned, but that was one thing that they provided, that type of signage to get people there. Making an appointment was not the easiest. We had to do by appointment only because there was such high demand in our area. Maine Health was using their electronic medical records, but although we were a Maine Health partner at that point, we hadn't adopted it. So we had to be really creative. So we used, as many across the country use, Sign Up Genius. People could self-register, but we needed to upload. They needed to have an email in there. That was our screening. So we had to upload about 30,000 emails, and invitations had to be sent. And we also use this to make the second appointments. So I call this volunteers in really loosely, because these volunteers that helped us do this were our churches and our senior centers. They were out of town kids. They were, anyone that had the ability to go online and knew someone's email. So we did a lot of outreach, because if you remember, our first wave, I think, was either 70 or 80 and above. So these aren't digital natives. So they really needed some help. One of our really outstanding volunteers was a Harpswell nurse, Gail Hayes. She was a vaccinator, but she also really helped her Harpswell neighbors. She was making so many appointments for them, and she just got recognized for that. Harpswell is actually one of the oldest, if not the oldest, town in Maine. So lots of help was needed there. Then we had greeters. This was 100% volunteers. This was the first person someone would see. They would screen for symptoms and eligibility. They made sure people had paperwork. They soothed people who were nervous. They were very kindly explained to people on why we couldn't allow walk-ins. They were out in the rain. They were, welcoming people, telling them what to expect. We then had one person we called the maitre d'. We very quickly learned that we needed to have a printout of every person with an appointment, and they had to be tracked really closely. Because this was offsite, we only had so much vaccine every shift. And if you remember, in the early days, we needed to use every single dose. We didn't waste a dose for 3 or 4 months, because we really had to make sure that everyone, if there was a no-show, maybe we would let someone in, but only if it was a multiple of 6, because that's how many were in the vial. We were ending at like 6 or 7, so we couldn't really call people to come out on a January night. So these people were really key at being very organized and checking people in and keeping count. And as you can see, Frank, one of our volunteers, wore a tux. He took his maitre d' role very seriously. Registration, this is the next stop. These are often our older volunteers, who often are traditional volunteers for the hospital. They were very great with paperwork. They were very calm. People could sit down. They just reviewed everything. They double checked eligibility when that was needed. And they just made sure that everything was in order, so that when people got in line to get their vaccine, that went really quickly. Again, 100% volunteer. The ones at the top they dressed up a bit for obviously our kids vaccination clinic. Even vaccination, we had about 50 to 75% volunteer nurses, mostly retired nurses, especially that really stepped up. And at some point we had to make sure that our flu nurses, who were our only per diem paid staff, we had to actually reserve a few spots for them. We had to actually have paid staff volunteer, because our folks that were paid couldn't get in fast enough to reserve a spot. And it's a really good mix to have in this vaccination role, to have a mix of paid and unpaid. So these were our volunteers, included our salaried folks that were volunteering their time, and our other agencies. We had, like I said, retired licensed nurses. We had student nurses, which were wonderful. We had a veterinarian that came in, and our pharmacy admin person that helped dispense the vaccine from the pharmacist, who was always paid, was also always volunteer. So check out, this is where our youth really shined, and Jesse's going to talk about a few of them. This is, again, Sign Up Genius. So to make that second dose, And these kids were our digital natives. They had no problem getting in there, making appointments, making this work. By the time folks reached here, also, they were pretty happy and relieved. So this is where I put my high school students, our Bowdoin students. They really loved this spot. And then on the furthest end were our impact. So every dose had to be entered in impact, which is the state of Maine vaccine tracking system. And it had to be entered within 24 hours. So we did it live. And that's where we had a few paid staff, but also some volunteers who were more introverted, were quiet, who really just like to do that data entry. And then observation was a lot of times where our retired physicians would be. And this was, again, 95% of these folks were volunteer. They got the stickers, they talked with people, they answered questions, people could get their selfies there. We did have 30-minute waiting area, obviously, if someone had a reaction. We did have some folks that needed to be transported, and these volunteer physicians were wonderful and great about keeping everyone calm and administering what they needed to. So who was paid? We did have a small core redeployed staff mostly. We had a director, we had a clinical and non-clinical manager that helped staff the volunteers and the other per diem staff. We had a pharmacy lead. We had non-clinical floor supervisors. We really thought that was unfair for a volunteer to answer some of those tough questions. So we did always have a handful of paid staff on there who could speak on behalf of the hospital. We had a charge nurse every time that was paid. And like I said, about 25 to 50% of our vaccinators and our support staff that kept the logistics and kept us Band-Aids ordered and all of that fun stuff. And that was that small but mighty team. So where did we find volunteers during a global pandemic? And that's really what the rest of our talk is going to be. And I'm going to turn it over to Jessie for that.
Hi, everyone. So we went the traditional route to start here. When we first started thinking about who we would recruit, we reached out to our medical offices, our local college here, Bowdoin College, some nursing programs, and a lot of our community partners. That helped us get people on very quickly. Because we had such a large vaccination clinic, though, we needed to think a little bit outside of the box for more opportunities. So we started thinking about places where we could recruit, such as restaurants. Right where we were located I don't know if any of you are familiar with Brunswick. We're in, as Melissa mentioned, the former Naval Air Station area, and Flight Deck Brewery is a brewery very close by. So they were wonderful in sending a lot of their staff over to help us volunteer. They were great. We also, a local taco truck. Not only did we get tacos from them every Tuesday, but they would also help us out. So there was a number of staff there that were very dedicated volunteers. We utilized high school students. So at first, we were nervous that maybe, they'd be too young, but we quickly realized how valuable their support was, how much they knew, especially when it came to technology. And because they were mostly remote, they had the ability to staff those afternoon, evening shifts that often our older volunteers weren't really up for coming out at those hours, but it worked perfectly for high school students and college students. We relied on family of staff and volunteers, local businesses. And you can see in the picture here, this was our Friday AM greeter crew. So they wore Hawaiian shirts every time they worked together in Lay's, and they created their own playlist, and they were super fun. And this group consists of a local soccer coach, some staff, family members, and community volunteers. We were fortunate to have Dr. Shaw's wife in our neighborhood area. She was part of our volunteer team. So lots of different folks came on board here. And then we took our show on the road. So as Melissa mentioned, we went to the schools once the 5 to 11-year-old pediatric age group became eligible for the vaccine. We went we already have partnerships with 3 different districts. So we had those relationships already. So it was really pretty seamless to work with our contacts there and quickly set up with the school nurses vaccine clinics that would run during the school day. So particularly for those kiddos who didn't have transportation and couldn't get to our regional clinic, we were able to vaccinate them during the school day. We also went to Bowdoin College and you can see a picture there in the upper left of the Farley Field House where we did a vaccine clinic. And then also our regional pediatric clinic, because we had so many kids in our region who were ready to get their vaccines. We were able to utilize a former elementary school and use the classrooms as different vaccine stations, and our volunteers to help us staff that as well. Next slide. Thank you. So a couple of tips that we put together here after our work is just creating a clear onboarding process. We created one email for volunteer requests and communication that helped us keep that separate because we had so many volunteers we were working with, about 700 non-clinical, 300-ish, 300 plus clinical. And we'd assign staff to onboard clinical and have separate tracking systems for clinical and non-clinical because they were such different roles. We needed to track that. We tried to minimize paperwork. We had an orientation. We used our volunteer coordinator to set that up so that she could come in and orient our volunteers before they'd start training. And then we'd always have a huddle at the beginning of every shift work because things changed every moment, every day. So we'd make sure everyone was up to date with any new eligibility requirements and huddled before every shift. Also being clear about roles. So we added this as well because particularly, with non-clinical and clinical, there's some overlap there, and we wanted our professional volunteers to be clear on what they could do and what needed to be sent to a unit lead or supervisor. If someone, like Melissa mentioned, if someone was, giving someone a hard time or pushing back, or if we had leftover vaccines and didn't know what to do, and everyone was often very eager to help and jump in, but sometimes it was better to have a system for who was responsible for what. And that just helped things flow easier, helped create less conflict. So that's another tip from us. And volunteer spotlight. So here's a couple pictures of our beloved volunteers. And I would say one thing that we really learned quickly is that we have this community, as do you, I'm sure, out there, of people with so many different sets of skills, and really placing people where they could shine made the work easier and a lot more fun. So many aspects of this work were completely new to all of us. So using skills that people already had and putting them in a role where they could utilize those skills was really the way to go and worked well for us. For example, one of our high school students, you can see there featured with Governor King, we had him in a unit lead role in the checkout role so that he had great technology skills that a lot of our older volunteers and even some of our younger volunteers didn't have. And there was a day when Sign Up Genius crashed, and I remember he got in there and fixed it and had a process to keep things moving until we could get it fixed. And so we were really impressed with the way a lot of the high school students could jump in and help us with the computer and tech needs. We had restaurant staff, as I mentioned, and they were really fantastic at being floor managers. So in particular, Ashley in the bottom right corner there, she worked at the Talk of the Town food truck, and she was fantastic. We ended up having her be a volunteer floor manager because she had great customer service skills. she was able to really manage lines and flow and create a process for people as they came in the door that was efficient and also helped them feel welcomed. We have Arthur Pierce in the bottom left corner here. He is a longtime hospital volunteer, and he's also a former superintendent. So he always handled the bus full of Bowdoin students and other schools that were bused into our regional clinic. And he was and still is our number one paperwork person. So he would talk through all the details of paperwork. And then Deb, who's another volunteer featured here, has actually become our staff on part. She's now employed by us. She was one of those volunteers that you could put her in anywhere. She'd jump into anything non-clinical and help out. And she was a huge asset to us. So we have hired her on to help us out as we continue to run vaccine clinics. So we were very fortunate to have so many wonderful volunteers and to be able to think outside of the box to utilize skills that you may not think are important in running a vaccine clinic. As Melissa said, it's easy to get focused on clinical, but having our public health experience and having these community partnerships really helped us quickly reach out, pull people in, use people's skills, and they made the magic happen.
And this is where the video is, Jesse, if you want to play that now.
Oh, yes. So I will play the video.
Or they'll play it.
It's been a really great experience. It's made me the most hopeful that I've felt since the pandemic started. I've learned a lot. I've met a lot of really great people, and it's really shown me what an amazing community we have and how we're all in this together.
I volunteered because I was so pleased that Midcoast provided services to those of us in Brunswick. I wanted to give back a little bit.
I've been retired for 10 years. I was an RN here at Midcoast Hospital and also at Maine Medical Center, and I decided that it was a good time to give back, so I'm volunteering and I'm so happy to be here.
So I'll be going to nursing school next year, and so it's kind of cool to see how the real medical field operates.
Such a huge chance to feel like we were making a difference and to contribute. We're not frontline workers, we're not giving shots, we're not doing any of that stuff, but it gives us an opportunity to really feel like we had a part to play and bring us all out of this mess.
We gave a vaccine to a 100-year-old woman, which was like super fun to see, and she was just so excited.
She was born in the Spanish flu and then went through this pandemic, so it's been really cool. It's something we look forward to every week.
I think one of the ones that they hit me the hardest, though, was a grandmother. It was probably 2 weeks ago. She came in and she was in tears, when she was handing over her paperwork at the end. She's like, I finally get to meet my granddaughter for the first time.
And when the people come in for vaccinations, they're all so grateful.
You can see the relief roll off the shoulders of people at each step. And when they go out the door, we say, thank you for coming, and they say, thank you for being here.
Everyone is so happy and working together for a common goal. Yeah. And, just seeing everybody want to go out of their way to help other people in their community, whether they know them or not, like that. It's such a good feeling.
It just means taking care of your community. I feel like it really means taking the love you have for everyone around you and putting it to good use. I have the energy, I have the time and the flexibility with my work schedule, but it's been powerful, and certainly powerful at this time.
It has given me a lot of hope, and I really feel that this is such an important place to be, because even a little bit of my time is making a difference. And all of many friends are coming back, as I am, as a volunteer nurse. And we are just so happy to be here and very grateful to have the opportunity.
little video with some of our beloved volunteers. And we'd love to hear from you. If you have any questions, we're happy to take them.
Thank you, Jesse and Melissa. That was a great presentation and so great to hear about your successful strategy. So for folks, feel free to enter in questions into the Q&A and we'll take those. We have a couple that have come in already. Can you talk, so one of the successful components was having, an emphasis on volunteer management. And so did that add additional work to the staff, and how did you handle that? Or had their work already shifted due to COVID response?
That was unexpected. And we did have to, a lot of my staff in community health had been redeployed, but we did in fact redeploy an extra person just to oversee the volunteers. And that was part of one of the paid positions was the non-clinical manager. And he did a lot of that work too. He took the communication piece. And then our volunteer director, as Jesse had said, that was her job. We had to work together on adjusting our volunteer for a regular volunteer. At this point, that process is a lot longer, and we had to really emphasize that this was a global pandemic volunteer process, and a lot of that had been streamlined. So she helped as well.
Great, thank you. In this, you have a couple questions about adaptation. So what lessons from COVID-19 are you now applying to large-scale flu vaccination efforts?
So funny you ask, we took over the flu vaccination efforts. We used to have community health and nursing do those, and we had a drive-through, but now that what we had found was that after going out to school several times, that actually the community, it seems to be easier and better to have a consistent location and consistent times and being there several days during the month rather than have pop-ups all over. So I think that was being consistent was one of the things we learned, that our pediatric clinic, especially the second round, instead of going to each school, we had one pediatric clinic and just opened up a lot of hours, and that seemed to work better than visiting each school. So I think that's one of the lessons learned is stay in one place, get down your system, and then tweak it a little bit, but people don't mind actually coming to you.
Thank you. And you might have done this answer already in that question, but can you talk about how you might adapt this volunteer recruitment strategy to other programs that need volunteers outside of vaccination efforts?
Some of it, that's an interesting question. I thought so, but I think really this was unique. I think people were looking for a way to help non-clinical folks as well. So a lot of our volunteers are now really busy back in their own lives and back in their own careers. So I think lesson learned is to be creative about who you recruit and who you ask, but I don't know that we would have ever been, I don't think we will be as successful as it was just the right time. The need was there and people had the time. So it was over. We're not joking when we had 1,000 names that we had to sort through. And I don't think that would happen with other public health topics.
Thank you. That's a good answer. And I would agree. You're probably right. And hopefully we don't have public health topics that come up that need that many volunteers that quickly. But if we do, we have this great program that we can learn from. So I don't see any more questions coming in, and we are just 1 minute before the hour. So thank you, Melissa and Jesse, for being with us today. And thanks to everybody as we conclude day one of our conference. We've really enjoyed these sessions and the questions that have come in. Please take the session evaluations. They are located, we've put them in the chat, but they're also located in the session description of each session, and you'll be getting a pop-up alert that includes all of the links to the evaluations as well. If you're having trouble with the conference challenge questions, please email mainpha@gmail.com and we can help you out. They are very specific answers, so we understand that. So sorry about that if it's too challenging of a challenge. but we've just enjoyed having you all here today, and we will begin tomorrow morning at 8:30 with our second keynote. So thank you all and have a great evening.
Thank you.